What's the right age for a neck lift?
Not a day goes by that I don't see patients who show me how they feel about their necks. They often pull their skin up and back from the sides or face down to show me how distressed they feel when they look downward at their phones. Naturally, they ask, "Can I have a neck lift?" Up to now, I had to assess the relative risks and benefits of performing this type of surgery based on the locations and extent of incisions, which may be too conspicuous for some people. I'll refer to this approach as an open neck lift. The most appropriate candidates for open neck lift, with some exception, are women who are in their 50s and older with lighter skin. This means that many men and women, including individuals with darker skin tones, are not eligible for an open neck lift procedure. We now have an option for men and women of any skin type and age to have a procedure with comparable results and in some situations with several unique advantages over open neck lift. We call this procedure neck contouroplasty, and I will discuss the details about how I perform this procedure and what kind of results can be expected. I'm Dr. Amiya Prasad. I'm a diplomate of the American Board of Cosmetic Surgery and a fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in New York City and Long Island for over 25 years. I've been performing surgical face and neck lifts throughout my career. I developed different methods and approaches to make these procedures more accessible by reducing general anesthesia risk and performing full face and neck lift surgery with local anesthesia and light IV sedation. This also enhanced the recovery process, allowing my patients to return to their regular activities much sooner than traditional approaches. In addition to surgical procedures, I also perform non-surgical facial rejuvenation procedures, which are based on my experience as a surgeon. For example, while conventional fillers are placed just below the skin, resulting in a lot of people looking puffy and doughy, I place filler in a way comparable to the way I would surgically place a facial implant. This approach helps my patients look defined, proportional, and more youthful. As I mentioned earlier, excessive volume under your chin is an all too common problem. People come in to see me and ask me to help them with their double chin or turkey neck. There are three important anatomical aspects of this issue that should be understood. Let's begin with excess fat. Excess fat under the chin can make someone appear to be overweight and older. The second factor is loose skin, which I refer to as skin laxity. Similar to the effect of excess fat, there is a lack of definition of the jawline and the perception of looking older and lacking energy. The third factor has to do with the muscles that support and define the angle of your neck and your jawline. In a traditional open neck lift, the procedure would involve the performance of liposuction as well as neck muscle surgery in addition to the placement of sutures to repair and tighten the muscles under the chin, which is called a platysmoplasty. Platysmoplasty has been the gold standard to address vertical neck bands, also known as platysmal bands. In order to address skin laxity or loose skin, the skin is dissected and separated from the underlying muscles, elevated and trimmed in a way comparable to what a tailor does. These incisions for the skin removal extended around the ear and behind the ear towards the back of your scalp. Until recently, open neck lift surgery was the only truly effective way to create a more defined neck and jawline by addressing the trifecta of excess fat, loose skin, and loose neck muscles. There are non-surgical procedures which can address fat under the chin as well as mild skin laxity. For example, I have a laser in my office which I use to non-surgically heat the skin under the chin and along the jawline. This results in fat reduction and skin tightening. However, if there is too much fat or the skin is too loose, this laser procedure is not going to be enough. Another example is that a few years ago there was some excitement about a trade-named product whose active ingredient is deoxycholic acid. This acid is injected multiple times under the chin, and the patient has to come back for multiple sessions. I found this treatment to be of very limited value, since I can reduce fat from under the chin with a cannula that's not much greater in size than the needles that are repeatedly piercing the skin to deliver this acid product, which also causes a lot of inflammation. I reduce fat from under the chin with local anesthesia, typically in only one session, making this deoxycholic acid injection procedure unnecessarily burdensome to people who think they're somehow having a non-surgical procedure. In my opinion, once a needle enters the skin, you are performing an invasive procedure. Another disadvantage is that the injection treatments do not specifically address loose skin. As far as neck muscle management and support, conventional minimally invasive strategies have been to place sutures through the skin with some success. These suture techniques are not to be confused with the recent fascination with various types of threads. In no uncertain terms, these thread procedures make for good entertainment on social media, but they do not in any way address the loose muscles in the neck. The question is then, can excess fat, loose neck skin, and platysmal bands, as well as weak muscles under the chin, be addressed without having to perform open neck lift surgery? The procedure we call neck chondroplasty is a minimally invasive surgical procedure which addresses these three issues without the incisions needed for open neck lift surgery. Neck chondroplasty is a combination of three different procedures performed through small openings below the earlobes and under the chin. First, liposuction is performed through these openings to address excess fat. Next, a technology called Renuvion is applied through these same openings to cause the skin to contract without having to remove any skin. Renuvion uses helium and radiofrequency to create heat from plasma energy. This plasma energy is delivered to the space below the skin in a way that generates collagen and causes the skin to retract inward. In contrast, several popular devices have very limited results because they try to heat the skin from the outside to very high temperatures, hoping that the skin will tighten. These technologies have been, with no surprise, more hype than substance. People complain that they don't work and that they've lost facial volume in a way that makes them look more hollow and even older. With Renuvion, the surface temperature of the skin remains relatively cool, and the effectiveness has been very well established. The last step of releasing platysmal bands and supporting the muscles under the chin is performed through the skin using a special suture suspension system called MyElevate. This system complements the skin contraction effects of Renuvion and is particularly effective in enhancing the neck angle, particularly when looking downward. Neck contraplasty is performed under local anesthesia or local anesthesia with light sedation. Our patients recover with minimal inconvenience and typically do not need to have any sutures. Although each part of neck contraplasty is performed without a traditional open incision, it is still a surgical procedure and is performed with the same level of sterility and judgment of open surgery. Based on this major advancement, I've changed my response to when a patient asks me, "What is the right age for a neck lift?" The age and range of patients we can help has significantly increased since I'm no longer limited by the risks of conspicuous incisional scars. This means that younger people, men, and people of all skin types can have neck contraplasty. I hope you found this information from my experience helpful. If you're interested in recommendations for your individual situation, you may contact us through our websites or call our offices to schedule a consultation. Thank you.